a lot of nurses in Korea who is looking into coming to Canada. There's also new grads. However, there's mother or father who is trying to come to Canada, but then they do have an experience, like say 10 years ago. They don't have any experience recent 10 years, and there's a big gap. And then a lot of people ask, would I be able to get a job in Canada? Well, I have a license, but I don't have experience. Would I be able to apply even? So what would you say to the people who's in that situation?
I think you'd have a really tough time getting a position if you have not had any experiences for 10 years. And you may be out of the workforce for many reasons, caring for raising children, helping out with family, etc. 10 years in healthcare is a long time to be. It changes a lot.
That's right.
I think you'd have to be mindful of where you're applying to again. So if you're 10 years out, but I see nothing, you haven't taken your CPR, you haven't taken maybe a refresher class, have you attended a course that shows me something that you've kind of kept current in 10 years,
That's right.
You'd have a difficult time. I will say. And that may be where you might have to entertain going to somewhere lower acuity first, and maybe a place like a personal care home versus going to either a community hospital or for sure tertiary care. Because if you're 10 years out, I don't know that many tertiary care facilities will say, come on in.
That's right.
That's a long time.
You're right.
It's a long time.
I was going to actually ask this question later in the interview, but then now that you mentioned about this, the opportunity, would they have a chance to get a job if they apply in rural hospitals? Say, I know there's a big hospital in Dauphin. I know there's other big hospitals in like Russell, that kind of places.
Yeah.
Would you consider applying those hospitals to get a job with no experience within 10 years?
I think you could attempt. 10 years is a very long time.
5 years?
5 years, I think. 10 years, when you think about it, that's a long time for somebody to have. You know, if you think of even equipment, right? Like our IV equipment in 10 years, pumps in 10 years. The fact that you haven't touched a patient in 10 years, do you remember how to do a full head to toe and document? Now, having said that, I think, you know, there's never a never, right? I do agree that the rural places, and if you have a high vacancy and you can really polish up that resume and show that you're keen and eager to learn, and reach out to a manager and do that. I don't know that no is ever an answer. I think when you have, you know, high vacancies like we do now, I think employers are open to somebody coming in, and I'll just say many places do have, as an external coming into an organization, there's sort of this usually a 90-day probationary period.
Okay.
Which is almost a safety net for the employer, because if you come in and in 90 days, you know, you're not able to show me that you have a minimum of a skill set and that you're progressing to be, you know, a safe practitioner. I think that's an opportunity as well. So again, back to that resume, back to selling, and what is it in the last 10 years you might have done that you could write those words? So maybe had you been caring for family at home, you know, did you do anything? And this is maybe a tip for future people who want to take that time off. Maybe you need to think about once in a while just keeping a shift here and there. So for future people, it's a long gap in a career that on a resume, it's a bit of a warning to a manager that says, ooh, that's a long time. I don't know if I want to invest, because there's a lot of investment for the organization to get you back to that basic.
Now that I hear from you, I'm going to have to tell my wife to rethink that getting a
nursing
license here.
Maybe not. I think some of it is, you know, is there opportunity in a refresher, right, in courses? What is there out there that can sort of help you to brush up on those some of those skills?
So now that you mentioned about the refresh course, in my case, I had a refresh course in EPC.
Yeah.
And then there was a 1 month practicum in Canada, experience in Canada, right?
Okay.
That was the PCH, personal care home. Would you consider that as an experience? Because I was a student.
Yeah, but it's current, right? And then I think the other thing you would want to have is there a bit of a reference from that instructor that did that clinical with you?
Yeah.
I think recently I'm just hiring a healthcare aide who really, he did a practicum here.
Good.
And his instructor wrote off on his evaluation, how he did, what he did.
Okay.
And that evaluation and that reference was worthy of getting hired.
Right. So in short, when applying, just pinpoint, make sure that your skill sets, make sure that you can do this and this and that, make sure to make it clear. And also current experience would be very important within at least 5 years, or just a gap would be like the maximum gap would be 5 years of no experience, you would say.
Yes.
And the other thing would be you guys would probably prefer experience in Canada rather than any other countries.
Yes.
Right.
And I'll tell you the reason for that, and I know this from being an instructor in the past. Nursing in other countries is very different than nursing in Canada. In Canada, you're doing a lot more primary care nursing. So you're not only doing assessments, documentation, you're doing the medication administration, you're doing the vitals, and then you're giving that information. In other countries, some international nurses don't do the vital signs.
Maybe different.
They don't know how to do a blood pressure because that might have been a physician role in their country. So again, knowing what the skill set that's required of where you're applying to, and then making sure that your resume speaks to that skill set that's required.
In terms of the application, lastly, there's so many things that we put in that application. So there's one of the things that we put as a Canadian status, like do you have a work visa? Do you have a permanent residency? Would you consider that when you are looking at the application?
I don't, because that really is more my human resources department. So in any facility that has a human resources department, that human resources department will make sure all of those little bits are done. And I think even from there to get a Canadian license, they're doing some of that work in the background.
Right,
so by the time you get to me as a manager, I really want to know, do you have a Canadian license? And I can tell because I can go on to the College of Manitoba and I always check, does somebody have a license? Because I can put anyone's name in and see, do you have a license? And then I'll look at your skill set and whether it suits what I have. The rest, all of that other permits and stuff, that's done by HR. That's in the back. Not me as a frontline. That's sort of the background of the human resources department.
You already have too many things on your shoulder anyway. So
well, I think it's such a level that's sort of, you have to separate. I'll be the expert to know what I need from a clinical perspective, and I need you to have a license and what your skills are. The other pieces like that, that's the expertise of human resources. Are you Canadian? Do you have a work visa? Do you have a social insurance number? They do all that background piece.
You got it.